You know, it seems like the older that we get, and I'm one of those that falls into that category, over a period of time, you start having issues with your knees. For some reason or other, maybe it's your job or whatever, or just getting older. What you do is you call and make an appointment with this gentleman, Dr. Lawrence Bourgeois, or with Dr. Greg Bredemeyer here at Nexgenesis on Three Rivers Road. How are you? Good to see you again.
Great to be back on.
I know you're excited about telling us about a special that y'all are running. In just a few moments, we'll talk about that. Yes. But first of all, let's talk about bone-on-bone issues.
Yes, you know, vast majority of the people that we see have been told that they're bone-on-bone, whether it's a knee, hip, shoulder, you name it. So that's who typically comes into the clinic.
Well, if they're having these issues, patients who have been, described with having bone-on-bone issues, things like that, they come in here and tell us what happens. I mean, first of all, the special that you're doing, tell us about that, and that'll compel them to call you and set this up.
Yes, so I'm real excited about it, something very new that we're doing. For the first 25 people that call from this show, you actually get a complimentary phone consultation with myself or another provider. So after we check that out, that lets us know really if you're a good candidate to even come into the clinic. And if you are, then we get you in so you can have a little more information before you even drive over.
What is the process when somebody comes over here and you examine them? I mean, what do you do? X-rays, images, things like that?
Absolutely. So in most cases, we're going to do X-rays. We'll also do ultrasound. We want to look at the soft tissue structures as well and the bony structures, and then we make our decision from there. Sometimes we need an MRI. It just really depends on what all we need after myself and Dr. Bredemeyer look at it all. And then we go from there. Okay, well, we're going to take a break and we're going to talk to Dr. Bredemeyer and find out more about what you can do to get rid of some of that issue that you're having with your knees. Dr. Greg Bredemeyer, how are you, my friend?
Excellent.
Good to see you again. You've been with this issue for a while. What got you interested into joint rejuvenation?
I've been doing emergency medicine for 40 plus years and stamping out fires, trying to stop these crazy situations, and realize there's got to be a better way and hopefully help people from getting into those situations in the first place, and regenerative medicines is a way to do that.
Now, talking about regenerative stem cells and other modalities, that's basically utilizing the body's own natural properties, correct?
Yes, sir.
To help
Absolutely. And stem cells and other natural products. I mean, were it not for stem cells, we wouldn't be here to talk about it. They've been helping us from embryology to old age.
Now, bone-on-bone issues, is this something that you see a lot of?
Oh, a lot. And that's part of the degenerative process.
I know probably more so when it's more older people.
Well,
but
of
I'm
course.
sure every now and then you see them in some young people, like athletes or something like that.
Well, yeah, the degenerative process starts at age 30. Not that everyone at 30 is going to have it, but you can see it on X-rays just starting, and it just cranks up.
Now, a lot of people have tried to deal with these issues with other forms, like steroids, physical therapy, things like that. Talk about that if you would.
Right. Well, yeah, and those things, they work, especially early on. Steroids can help, but you just can't keep doing those. Many orthopedic surgeons they certainly give those and they help, but over time that can be definitely a deficit to the joint itself.
Now, Dr. Bourgeois mentioned a special that y'all have going on here. Talk about that for the first 25 callers that see this show today.
Yes, sir. We have, basically you can call in, you can talk to Dr. Bourgeois, he can get some history, see if you're a candidate for what we do, then come on in, and then both he and I will see him. It's a team effort, a team approach. Now,
I'm sitting here looking at this thing. What is this? I mean, it looks like an ultrasound.
That's it. And this is my baby. I love this thing. And the ultrasound is just becoming a tool in all of medicine.
Well, I know you think of ultrasounds, you think of, okay, we're going to look at the baby now, right, and here's the ultrasound and all this. But you use it more so now to deal with this joint rejuvenation.
Right, and you can use this for diagnostic purposes, and also there's ultrasound guided injections that it's so beneficial for.
You use it for evaluating?
Yes. Yes.
Okay. Talk about that, if you would, just a little bit on how
You know,
that's used.
You can see actually the soft tissue. Of course, we don't use it here. This is comparable to an emergency medicine ultrasound where they look at gallbladders and you name it, and babies. But here we can look at nerves, tendons, structures like that, some joints, and then help guide injections.
Okay. Do you do x-rays?
Oh, yes, sir. We also do x-rays, kind of a standard procedure as well.
What do you find more of that you're people having issues with? I mean, like Dr. Bourgeois mentioned, whether it's knees or hips or your shoulders or things like that. And I guess, well, I mentioned young people, athletes. I'm sure you see a lot of those with shoulder issues or even knee issues. And you work with them, because if you talk about working with people that have issues with their knees or whatever, you might think, oh, that's for old people only. But it's not.
No, no. Like I said, age 30, it starts. And over the years of trauma, you damage a knee. It's the larger joints that we see the most thing of: shoulders, hips, knees.
What are some of the symptoms? People might start wondering, do I have it? I mean, I guess their knees pop when they're walking, or?
Knees, over time, they'll pop, they'll grit, and that's very common. Unless associated with pain, it's not a problem. But you can get instability if a knee starts locking up, especially shoulders with the rotator cuff. That's a complicated joint, and tears over the years can really decrease your range of motion, strength, and all.
Yeah, I've been having an issue with my left hip here recently. Go to get up out of bed, and it's like, oh,
Right.
that's kind of getting painful. Of course, I am getting up there retirement age, so I think I might have to be one of those 25 callers that call in here. But anyway, Dr. Breedemeyer, always good talking to you.
Yes, sir. Thank you very much.
Thank you.
All right.
Dr. Bourgeois, people having issues all the time. I mean, because down here we like to try to stay active. I mean, we have a lot of snowbirds that come down here. And so these are issues that you deal with people on a daily basis.
Absolutely. I mean, you know, some of the biggest things I hear is, you know, people having issues with walking on the beach or going to exercise, walking the block with their family members, going on vacation. They can't do it because they can't walk far enough, or just going shopping. So, I mean, this is really affecting people's everyday life, and that's what we're here for. We're helped to live a happy, healthier life.
Talk about this special going on right now again, if you would, please.
Absolutely. So for the first 25 callers, you get a complimentary phone consultation with myself or another doctor to see if you're a good candidate to come in, so we can skip, find out if you're a good one before you drive over, you know?
I know, because I know you have people coming here from all over the place to do that, from the entire south part of the state. So anyway, if you're having some issues with joints, whether it's your knees or your shoulders or your hips or anything like that, any of those things, anything where there's a joint, what you need to do is call, make that appointment here with Nexgenesis, 3 Rivers Road in Gulfport.